Trying to get a diagnosis for Andy's problem was very frustrating because nobody had answers.
The pain was absolutely killing me. I probably saw 8 to 10 doctors, and basically they kept calling it that pain was my new companion, and I just had to learn to live with it.
When we found out the diagnosis, it was a relief. Finally have someone who could tell us what she has, and that's the first step to treating something.
I live in North Potomac, Maryland, which is about 30 minutes north of Washington, D.C. by train. And I have 2 sons. My husband and I have been married almost 40 years. I worked for the federal government my entire professional career. I'm very much into exercise. I walk once or twice during the day. My husband and I enjoy going downtown to the exhibits in Washington, D.C. I enjoy needlepoint. I find it very relaxing. And also I have something physical to show when I complete it.
Andrea is a very kind, considerate, loving person, great wife, great mom. She's tenacious. That's why this journey with her illness has been a real challenge, because we haven't been able to find answers.
My symptoms started about 4 years ago. A lot of gastrointestinal pain, discomfort, nausea, bloatedness, generally just feeling horrible. The pain was absolutely killing me. My name is Andrea, and I have EPI.
Exocrine pancreatic insufficiency, it's also referred as EPI. And it's a condition that happens in patients when the pancreas it's not making enough enzymes, and or when the enzymes, once they reach the small bowel, don't function the way that they should. There are 2 groups of patients that can develop exocrine pancreatic insufficiency. First, we have patients that have a primary problem of the pancreas, meaning that the pancreas it's not making enough enzymes. There's a second group of patients that develop exocrine pancreatic insufficiency but have a normal functioning pancreas. So the pancreas is doing its job, but once the enzymes are released, they're kind of like damaged. Both of them clinically look very much the same.
The pain is something that's part of the syndrome.
Where is it worse?
Right here.
Does it go around to your back?
Yes. It feels like someone punched me in the gut from my pelvic area to underneath my breast, and it goes around to my back. The pain was so uncomfortable I wasn't able to sleep for 3 months.
The typical symptoms that we hear from the patients are abdominal pain, gas, bloating, diarrhea, and all of this has to do with the fact that the food, instead of being absorbed and going inside of our bloodstream, it's going straight down to the small bowel and mainly to the colon. And the patients actually will tell us that they're seeing fat droplets in the stool, and that's what we call steatorrhea.
Trying to get a diagnosis for Andy's problem was very frustrating and is very frustrating because nobody had answers.
I probably saw 8 to 10 doctors, and basically they kept calling it chronic constipation, that pain was my new companion, and I just had to learn to live with it.
Making the diagnosis of EPI can be very challenging because there's a lot of overlap, particularly at the beginning of the disease. For example, irritable bowel syndrome. Patients may have gas, bloating, abdominal distension, and you may think, okay, this may be EPI, this may be IBS, but unfortunately, as the disease progresses, it may become more obvious. When you start to hear that the patient is losing weight because they're eating actually and the food is not being absorbed, that should be a major red flag. But also you need to have a clinical suspicion. You need to get a very good history. You need to talk to your patient. If you have radiology, you have to review the images to make sure that the pancreas looks healthy or not.
I went to many gastroenterologists until I finally went to a functional medicine physician who did tests that the GI doctors did not do. They were basically 8 stool tests altogether, and they test enzymes in your stool to see how difficult or easily foods are digested by examining the level of enzymes. So that was what determined the EPI.
There's tests that are direct stimulation of the pancreas and measure the amount of bicarbonate, the amount of enzymes that are being secreted. There's indirect tests of function of the pancreas, so that will give you a very good indirect idea of how well your pancreas is functioning. There's also a test that is considered to be the gold standard that is called coefficient of fat absorption. So the prevalence of EPI depends on the underlying condition. If you have, for example, cancer and they remove most of your pancreas, 100% sure you're going to have exocrine pancreatic insufficiency. If you have a tumor in the head of the pancreas that has not been resected, but most of the gland is sick, very much sure that you're going to have exocrine pancreatic insufficiency. There's other conditions, for example, diabetes, celiac disease, chronic pancreatitis without calcifications, and others that the prevalence is much lower, 10, 20, 30%, because they still have enough pancreatic tissue to make a good amount of pancreatic enzymes. Another condition that we see a lot is patients with cystic fibrosis. Most of these kids with cystic fibrosis actually are born already with exocrine pancreatic insufficiency.
When we found out the diagnosis, it was a relief. Finally have someone who could tell us what she has, and that's the first step to treating something.
Once you develop exocrine pancreatic insufficiency, it is a chronic condition because the pancreas is one of these organs that once it's damaged, there's no way to bring it back. In general, EPI, when it's not treated or not treated correctly, the quality of life actually goes down and the mortality may go up. We treat EPI by giving the patient pancreatic enzyme replacement therapy. We're mimicking what your body should be doing. And it's very important to make it clear for the patient to take the enzymes together with food.
They're very large capsules, and I take 3 before every meal.
We also tell patients to have healthy eating habits. Once you find what works for you, the dose of enzymes, how to take them, what you should eat, what you should avoid, your quality of life, the symptoms are going to significantly improve.
Even though I had a diagnosis and I was finally taking enzyme therapy prior to meals, it didn't totally alleviate the pain because my body does not make amylase, lipase, or protease to digest proteins, fats, and carbohydrates. So I have to be scrupulous about the way I eat. My diet consists of a very low-fat diet. I feel bad for my husband. We often make separate dinners because I eat so little and it has to be low-fat. He's certainly been there every inch of the way, and I thank him very much.
So EPI has a significant burden, not only in the patient, but also in the family. It does affect the things that they do socially, because some conditions can be very debilitating for the patient. You can imagine if they have chronic pancreatitis with pain and they have EPI, traveling, going to a restaurant, going to a cruise, going abroad, it can be very difficult.
We cope with the emotional stress by staying busy, staying close, being supportive for each other. And I just keep thinking that what she's dealing with, and if she may be in a bad mood, I try to understand that it's not me, it's the pain.
We can help patient outcome in multiple ways. Number one, making the correct diagnosis, making sure that the disease that they have is truly led to EPI. Make sure that they're taking the right medication. You want to make sure the patient is seen by a nutritionist that have an interest in the pancreas. So you need a whole group caring for this patient so they can have the best outcome. Patient support groups and advocacy groups play a major role in these conditions in EPI. There's a lot of places also online that patients can go for reliable information. It's very helpful to have somebody that you can relate to, somebody that can give you advice. So support groups, in my experience, play a major role and they have a very positive effect in patients. I am very hopeful for the future regarding the diagnosis and treatment of EPI. And I know there's a lot of research being done to make the diagnosis earlier. I know there's new medications that may be coming down the pipe in the near future. A lot of things now are actually under clinical trials, and I know that the future is bright.
Today, my health is fine. As of my appointment 2 weeks ago, I still have pain, and I have 3 types of pain medication that I have on hand for what level of pain I have. I've made an appointment with Johns Hopkins with actually a pancreatic specialist.
I'm hopeful because until we use up all the resources, we'll do whatever we have to do. It's been a long journey. We hope there'll be an end to it. Try to stay hopeful. I know it's difficult. And be tenacious. You just got to keep going after it. Try to find the solution.